Having undergone specialist training in Moorfields Eye Hospital in United Kingdom, I had returned to my hometown of Ipoh in 1974 with the aim of providing affordable, quality eye care services to my patients. LEC Eye Clinic was founded at that time, and from being a solo eye care practitioner in this clinic, LEC Eye Centre was subsequently born in 1999 with the inclusion of 2 other consultant eye surgeons. Since then, we have grown to become a Ministry of Health recognized day surgical centre, and to date, LEC Eye Centre is the largest private group practice in Perak with 4 consultant eye surgeons.
LEC Eye Centre is a one-stop comprehensive eye specialist centre, and we're able to cater to all the eye care needs of our patients. We pride ourselves in having the most advanced technology to provide the best outcomes for all our patients. We have premium cataract surgical services, and this involves the acquisition of the first Lenstar optical biometer in Perak, which is actually a laser machine used to measure the eye before cataract surgery. We also have another advanced machine called the Varion Image Guided System, which is actually a precision machine that provides digital marking during cataract surgery. Now, aside from this, we also provide retinal services, and this includes the management of retinal detachment, age-related macular degeneration, and diabetic eye disease. We acquired the first in Malaysia sweat source OCT angiogram, and this actually allows us to take high-definition images of the retina and better manage these diseases. We also want to make sure that we are always accessible to all our patients, and they can make appointments to see us with a click of a button via our online appointment system.
At LEC Eye Centre, we have our in-house optometrists who are vision care experts responsible for accurate testing of spectacle power as well as contact lens fitting. They also provide vital support to our LASIK services. At LEC Eye Centre, we acquired the first in Asia wave-like refractive suite in 2011. One of the fastest lasers in the market, this unique all-in-one suite connects the machines used to measure the eyes before surgery with the laser machines, so all treatment information is sent wirelessly and allows surgery to proceed seamlessly and with unparalleled precision.
At LEC Eye Centre, we recognize the increasing problems of nearsightedness or myopia amongst children nowadays, and we have in place a myopia control program to combat this. This program involves the use of myopin and eye drop, which has been found to be effective in slowing down the progression of myopia in children. So this program aims to increase awareness about myopia and allows our team of doctors, optometrists and nurses to work closely with parents to manage this epidemic which is sweeping the world. A key component of this program is the use of appropriately prescribed eyeglasses, for which our subsidiary company, Eye Care Optical, will be able to provide. Aside from children eyewear, a wide range of adult eyewear is also available.
Hi, good evening, everyone. I would appreciate those who have just joined us in the Zoom. I would appreciate you all would just mute your mic so to minimize your interruptions. We will have the Q&A session. By then, you can unmute yourself to ask question directly with Dr. Lim, okay? So tonight, we will have a session with Dr. Lim, and he will be sharing why am I seeing mosquitoes. What is this mosquitoes that he's actually referring? Is it the real mosquitoes or is it the mosquitoes that you're seeing in your vision? So if you have actually followed our Facebook Live in the past, since last week and past few days, Dr. Lim did also share about what is the mosquito that he's referring, as well as some other blinding eye disease as well. So if you have any question, hold on to your mic, okay? We will do the Q&A. We will let you ask any questions about eye related with Dr. Lim, okay? So don't worry. Now for those attendees in our Facebook, you can actually put in your questions in the chats and we will also answer the questions as well. Hi, Wai Teng. Hi, good evening to all. Okay, good evening to all. So can I have the Dr. Lim's profile? I will just have a quick introduction for Dr. Lim. Pretty Mary, why your hand is raised up? Is there anything that you need help with? Then maybe you can put in the chat so that we can actually assist you. All right, so for Dr. Lim is actually our full-time consultant. He's actually our senior consultant who actually graduated from University of Malaya Hospital in 2003. And he's also the head of a department, the ophthalmology department in Hospital Teluk Intan in 2004. Dr. Lim is also a very competent surgeon for cataract surgery with wavefront, guided toric multifocal intraocular lenses, as well as a LASIK surgeon. He's also a pterygium excision. We call him a pterygium king, okay, in LEC with the conjunctiva graft using the fibrin glue. Also, he performed trabeculotomy surgeries, which he will actually talk about regarding glaucoma, right, Dr. Lim?
Yes, correct. That's
yeah,
right.
as well as for the glaucoma management, screen eyes, as well as the eyelid surgery. Dr. Lim is also a visiting consultant. Right, see, I say the interruption. Kindly mute your mic, please. Okay, so those who have just joined us, kindly, I will appreciate you would mute your mic. So Dr. Lim is also our visiting consultant in Perak Community Specialist Hospital as well. So for any emergency cases during the weekend or after the office hour, you may actually go to Perak Community Specialist Hospital, whereby all our three surgeons are on call, all right, for the A&E department for the eye cases. So, okay, without further much ado, let's have Dr. Lim to share his screen.
Okay, hi, everybody. So I'm going to share my screen now and begin my presentation.
Right. Just give Dr. Lim a second, all right?
Give me a second.
And we just pray that the internet will be stable tonight, because I think for last week, the internet wasn't very stable. So we just hope that the internet will be stable.
Can you see my screen now?
Not yet, Dr. Lim.
Not yet, huh?
Yeah.
So,
no problem. So good evening to all. We have Karina Lam, we have Wai Teng, we have Brenda Chong, we have William Mok, we have Yuan Chi, we have Yanis Lim, we have Connie Makmanyi, Yo Eng Lan, we have Yok Hing, we have Chi Yan Yong, then Chinese name, sorry, I can't read.
Anna, can you see my screen, Anna?
Not yet, Dr. Lim.
Oh, yeah, sorry,
not yet, no problem, no problem. Just sending greetings to all. Mary Shalam, then we have JK Chong, we have Kam Yok Ying Liu. We have Yuan Chi. So thank you for joining us. All right, Dr. Lim is sharing his screen, okay? Just give him a second. We're pretty merry. So we also have some attendees from our Facebook. So say
Anna,
hi. Yes, now we can see your screen. Good.
Okay, good. Sorry, took some time.
No problem. Thank you, Dr. Lim.
Okay, so
yeah.
okay. So the topic of my talk today is actually why am I seeing mosquitoes? But apart from that, I'm actually talking about quite a lot of other eye disorders. It's just that I chose the topic as mosquitoes because it seems quite interesting. Okay, so I shall begin my talk now. So I think to understand the talk, you'll need to know some basic anatomy, some basic knowledge about the structure of the eye. Just want to bring out my laser pointer. Okay, so this is actually a cross-sectional view of the eyeball. Okay, this one here is the front part of the eye. Okay, and this transparent curved dome-like membrane in front, which we can see here also, is called the cornea. So cornea is a transparent dome-like membrane right in front of the eye, at the very front of the eye. Okay, this is where light enters into the eye. Okay, and then just behind that we have the pupil. Pupil, as we all know, is that hole at the center, the aperture at the center. And behind the pupil is, everyone has got a natural lens. Okay, this is a natural lens of the eye. Okay, so the lens of the eye helps to focus light onto the retina behind. Okay, now to understand the floaters, actually you have to know that this space right behind the lens is actually not empty. This space here is actually filled with this jelly-like substance, what we call the vitreous gel. It's a transparent gel-like substance actually. Okay. And at the very back of the eye here, we have the retina. Retina is actually a layer of nerve. Okay, you can see that it's got many blood vessels running on it. Okay, so retina is the very important part of the eye where light falls on the retina and the image is formed. Okay, and at the very center of the retina, we have an area called the macula. So macula is the center of the retina where all the sharp images that we see are formed at. Okay, and once the image is formed in the retina, the image signals from the image will travel via the optic nerve all the way to our brain, to the what we call the visual cortex, where this image will be processed so that we can understand what we are actually seeing. So this is actually the basic structure of the eye. Okay, so coming now to my topic here, floaters. So what is this floaters actually, and why is it called floaters? So floaters, actually, I'm sure some of us or many of us can actually know what I'm talking about. They appear as small, dark, shadowy shapes, okay? That may look like spots, strands, cobwebs, or clouds in your field of vision, okay? They are like floating around. They may even follow your gaze. If you look to the right, it seems to float towards the right as well. If you look to the left, it will also follow your gaze. And then sometimes they may have associated what they call flashes. So some people at the same time, they may see flashes of light in their eye. They may see something like lightning flash, or they may see something like camera flash. And this is actually happening internally in the eye. It's not from an outside source. Even in the dark, or when they close their eyes, they can actually see these flashes. In fact, if they close their eyes or if they're in a dark room, these flashes are more obvious. Okay. So floaters, usually they appear during your late 30s or maybe after 40s. But for people who are myopic, myopes means short-sighted. Short-sighted people, especially those who are quite highly short-sighted, they may actually see floaters earlier on. Some people who are very short-sighted, like maybe like 6, 7, 800 degrees, maybe even as teenagers, they may already start to see a few floaters. Okay, generally, these are what floaters look like, by the way. Okay, some they look like hair strands or like worms, many different shapes. Some is like flying mosquitoes. So actually, what is the reason? Why do we see floaters? Okay, floaters actually is caused by age-related degeneration or liquefaction and shrinkage of the vitreous gel in our eye. So in the slide just before this, I had shown that the eye is actually filled with this jelly-like substance, the vitreous gel. So as your age goes up, this ball of jelly, areas within this ball of jelly, it starts to liquefy. Okay, areas of it become liquid. And these areas of liquid or liquefaction, when light enters, it will cast a shadow onto the retina, and we see that as all these funny shapes here, these floaters, okay? So actually here you must understand that floaters is actually not an eye disease. It's actually a natural phenomenon, mainly due to our increasing age. You don't have to be like very old to experience floaters. As I mentioned just now, some people who are like short-sighted, they can actually see floaters even in their teenage years. So actually it's a natural process. It's just that as your age increases, certain areas in the jelly of the eye, they will have areas of liquefaction, and this will cast shadows on your retina, so you see as floaters. Okay, so these floaters is not an eye disease, right? It's actually a natural thing, a natural phenomenon. But then, although it's a natural phenomenon, is there any danger? Does it pose any danger to the eye, or is it just a harmless thing? Okay, so should I be worried about floaters? So again here, just a bit on the physiology of it. The vitreous gel, which I mentioned just now, this is actually in this cavity of the eye, and this vitreous gel, it is normally attached to the retina. Okay, this ball of jelly is sitting inside, and it's actually attached to the surface of your retina. Retina is your nerve here. Okay. Now, when the vitreous degeneration or the liquefaction starts to occur, okay, that's when you see these floaters. Okay. Now, when this vitreous gel degenerates, the vitreous gel will also contract. Contract means like shrink. Okay. So it will shrink, and because it is attached to a retina, as it shrinks, it will pull on the retina. Okay. So in fact, this pulling on action on the retina is what causes the flashes of light. Okay. Now, this may at times cause the retina to tear, because this vitreous jelly is actually attached to the retina. As it shrinks and contracts, it will pull on the retina. Sometimes it happens to pull a bit too hard, the retina actually can tear. See, so when it tears, this will cause a hole in the retina. Some of you may have heard of this, a hole in the retina. Okay, see here, this is what has happened now in this second diagram here. Okay, a retinal tear has happened because in this part here, the jelly has shrunk and it pulled on the retina, and the retina has become torn. So now there's a hole in the retina here. So now what happens if there's a hole? If there's a hole in the retina, there's actually quite a high risk of this becoming what they call a retinal detachment. Okay, so retinal detachment is when the retinal layer peels away from the wall of the eye. So obviously, when the retina is detached from the eye, it will of course lead to blindness, because retina is the layer of nerve where the images are formed and transmitted to your brain to let us know what we are seeing. Okay, so what happens is like this. So this area of the retina here, there's a hole here caused by the vitreous jelly shrinking and contracting here, pulling on it. So now a hole has happened. So once a hole has happened, any liquid in the eye, especially the areas of the jelly which has already liquefied, that liquid will enter into this hole here. It will flow into this hole, and it will flow behind this layer of retina. So obviously, when there's liquid behind the retina, the whole retina will get separated from the wall of the eye. Okay, so that's called a retinal detachment. So this is obviously a blinding condition. Okay, so this is the danger that you have to watch out for, the complication that may occur if you have any floaters. Okay. So why is it urgent to see a doctor if floaters? It's urgent, of course, because when you see floaters, it means that your vitreous gel in the eye is degenerating and contracting and pulling on the retina. So there's always a risk of a retinal hole happening. And a retinal hole, as I mentioned, can lead to a detachment and can lead to blindness. Okay, so why is it urgent to see a doctor? Okay, if the doctor will check, of course, and if a retinal hole is detected and it is treated early, there's a good chance that a retinal detachment can be prevented. So here I've shown a diagram. Okay, if you have a hole in the retina, this is what the doctor will see when he looks into the eye. Okay, this orange background here with the blood vessel, that's the retina. Okay, now if you look carefully here, you can see a circular outline of a hole here. Okay, now this surrounding this hole, there are many white spots. Okay, this is actually laser marks. Okay, so this is actually a retinal hole which has been treated by an eye doctor. Okay, so the way to treat it is actually by doing something called a laser retinopexy. So what the doctor does is he sort of seals off the surrounding area of the hole by welding. It's actually by firing these laser shots here. So these laser shots, they will cause inflammation, and hence this part of the retina will stick down to the deeper layers. Okay, so this over a time period of maybe 2 to 3 weeks, a scar, a circular scar will be formed around the hole. So the hole will be sealed off. Now, why is it important to treat this hole as early as possible? Now, if sometimes vision may not be satisfactorily restored if treatment of a retinal detachment is delayed. Okay, so if it's just a hole which has just happened and you miss this stage of treating it, you allow this retinal hole to cause a retinal detachment to happen. And if the retinal detachment is serious, that means if the retinal detachment has involved, especially the central part of your retina, which is the most important part of the vision, then even if you do surgery to flatten back the retina, to make the retina stick back, depending on the function of the retina, your vision may or may not be actually restored. Sometimes if the retina has been detached for quite a period of time, and even if you have done the surgery, the vision may not be, you may not be able to regain like very good vision. Because when the retina is detached, it can be said that the blood circulation or the oxygen supply to the retina will be very deprived or very poor. So the longer you leave it, then the higher the chances that the retinal function will continue to deteriorate. Okay, so any treatment must be initiated as soon as possible. Of course, preferably is when it has not become a retinal detachment. When it's just a hole, then you can quickly seal it off using laser. But once a retinal has developed, a retinal detachment has developed, then you cannot just laser the hole. You'll need to proceed to do retinal surgery, which is of course much more complicated. Okay, as I mentioned just now, I will also talk about other common disorders of the eye. Okay, so what can be more common than what we call refractive errors? Okay, refractive errors. Okay, this basically means a layman would call it power. So actually, this so-called power or refractive errors actually is divided into three types. So first here is, I would say the most common is something called myopia, which in simpler terms is actually called nearsightedness, or even more simple terms, it's actually called short-sightedness. Okay, the second refractive error here is called farsightedness or hyperopia. This one may be a bit less common, so many of you may not have heard of this term, okay, but it does exist, hyperopia or farsightedness. And lastly is something which I'm sure almost all of you would have heard of it, astigmatism. In Chinese, they call 散光, okay. So all these three, myopia or short-sightedness, hyperopia or farsightedness, astigmatism, these are all refractive errors, okay? And refractive errors, they can all be corrected. I would not consider them a disease, okay, because they can be corrected using either glasses, contact lenses, or other methods. They can be corrected to give you perfect vision, okay? So I would not consider them as eye diseases, okay? This is just a ray diagram or a light diagram just to further illustrate to you what are the refractive errors. So here in the first diagram, in the normal eye, light enters the eye and it will get exactly focused right on the retina itself to give you a very sharp image like this, okay? That's called emmetropia or normal refraction of the eye. Now here is a diagram illustrating myopia or short-sightedness. So in a short-sighted eye, a myopic eye, light enters, but the light does not come to focus on the retina. Before the light has reached the retina, it has already focused to a point in front or before the retina. So as a result, the image on the retina is blurred. Okay, it's blurred. Okay, so that's called short-sightedness, means that the light comes in the eye and gets focused in front of the retina rather than on the retina. Now, the other refractive error is something called hyperopia or farsighted. Okay, this I would say can be called as the opposite of myopia. So light enters and the light, instead of being focused on the retina, it actually comes to it focuses on a virtual point behind, some distance behind the retina. Okay, not in front, not on the retina, but rather behind the retina. But the effect on us is the same. We see a blur image. Okay. Now this one is 散光 or astigmatism. Astigmatism. Now, in this condition, the light that enters the eye, some of it is focused on the retina, but some is focused at different points. Some may be focused in front of retina, some may be focused behind the retina at different areas, okay? So that means light coming into the eye does not come to one focal point. It may actually be refracted into a few focal points. But the effect is the same. We don't see a clear image. There's blurring as well. And one what we call particular symptom about astigmatism is that because the light that goes in practically goes everywhere to many places, usually the sufferer of astigmatism, they will complain of glare in the presence of bright light. Glare. Okay, these refractive errors, as I mentioned just now, they are not diseases. They can be corrected to give you perfect vision. So what are the ways that we correct refractive errors? Okay, the simplest, I'm sure, and the most common, I'm sure everyone knows, is actually using glasses. Okay, second, there are also many people who choose to use contact lenses sometimes, okay, or most of the time. And the third option to correct refractive errors actually is by surgery. Yes, there is actually surgical methods to correct refractive errors. Okay, the most commonly employed surgical method to correct refractive error is actually something called LASIK. LASIK. Okay, and sometimes in certain cases, there's also another method is actually intraocular lens implantation. Intraocular means in the eye. Lens implantation, that means in this surgery, we implant an artificial lens into the eye. Okay, rather than having a contact lens sit on the surface of the eye, this lens can actually be implanted inside your eye. Okay, so that's called intraocular lens implantation. So basically, these are the three methods here to actually correct your refractive error. I will just go a bit more detail on each of these individual methods. Okay, glasses. Okay, very simple. Of course, it's the simplest way to correct vision. It's very simple because it doesn't involve surgery, and then you don't have any contact lens related problems. Okay. Now, what are the disadvantages or cons of using glasses? Well, of course, you need to put them on to see clearly. See here, if you don't have them on, you can be almost like blind, Okay, and then if you wear glasses, it may be inconvenient for some activities like sports. And then some professions, you may be unable to pursue some professions like, for example, pilot or police. And then cosmetics may be affected. Some people think that they don't look very good with glasses on. And then, of course, there's also cost, especially those glasses with high short-sightedness or high astigmatism. They can actually be very costly. Okay, coming to contact lens, which, as I mentioned, is another very common method to correct your refractive error. So here the pros, advantages. Well, as I mentioned just now, some people think they don't look that good with glasses, but so they go for contact lenses to avoid glasses. See, like this picture here, maybe you can decide for yourself whether you look better with glasses or without glasses. Okay, and contact lens is convenient for most sports. They don't get in the way, except of course swimming. You're not supposed to swim in your contact lenses. Okay, their disadvantages. Okay, contact lenses, they need very strict care and maintenance regime. Okay, you have to be very strict about this. And then commonly contact lenses, they can cause dry eye. Sometimes they can cause eye allergies. And in a very severe cases, they can actually cause a very bad infection, something called a corneal ulcer. Here I've shown a case of a particularly severe case of corneal ulcer in a contact lens wearer. Okay, so because of probably some lapse in the maintenance regime and all that, the hygiene, so an infection of the cornea has happened, and you can see there is a white patch or white area on the cornea. This is actually an area of infected cornea, okay, a bacterial infection, and the eye is very red and inflamed. So the problem with this kind of corneal infection is that after the condition has actually like resolved or so-called cured, this white patch here will remain there in the long term as a scar. So as you all know, a scar is always permanent. So this scar which remains will cause permanent obstruction to your vision. If the scar is very bad, like in this case, it's going to leave a very big scar right at the center. So this patient, even after recovery of the condition, this scar will remain and will cause severe blurring of vision. So in this particular case here, I would say that probably this patient will need what you call a corneal transplant after recovery. That means the whole cornea needs to be excised out, removed, and replaced with a donor cornea. That means somebody will have to donate a cornea to replace this scarred cornea here. Okay, again on contact lenses, that's why as I mentioned, contact lens you need very strict maintenance regime. Okay, why? Because there's some incidents of complications happening with contact lenses. These are just a few examples. Okay, this one first. This one here is I would say quite common. I do see it in quite a lot of the contact lens wearers who come as patients here. Something we call erosion, corneal dot erosion. So in this condition, if we examine the cornea, the eye, under special staining technique, you can see that the surface is actually full of all these little dots on it. All these little dots are actually mainly due to severe dryness, causing some of the superficial cells on the surface of the cornea to actually have like dehydrated and so-called dropped off. So all this results in all this erosion. So this will actually cause a severe glare as well as blurry of vision for the patient. Okay, the next one here is something called a corneal abrasion. Okay, corneal abrasion in a contact lens wearer is most of the time also is secondary to dryness. Dryness is usually a predisposing factor for this to happen. Okay, so in this picture here, quite a large area of the cornea has already become abraded. That means the superficial layer here has actually become abraded off or come off. Okay, so this is another thing which may happen with a contact lens wearer. And then here in the third picture here, I'm showing actually what I call giant papillary conjunctivitis. So this is actually a kind of allergic reaction to either the contact lens itself or the contact lens solution. Okay, so this will result in this condition here. It's a type of allergy. Okay, a few more complications which can happen. Okay, here we have something called the tight lens syndrome. So in this eye, if you look carefully, you can see that around the cornea, there is a kind of a circular mark here, okay? So this condition is usually caused by a contact lens which does not fit well. So when the contact lens does not fit well, it's too tight. When you put it on, after a few hours, there will be like a suction cup effect on the eye, okay? So in a condition like this, because the contact lens is too tight, tears cannot flow under your contact lens. And as a result, the cornea will suffer from lack of oxygen. So this will worsen the dryness and also lead to other problems. As I mentioned just now, it may lead to the dot erosions and the corneal abrasion. Okay, another condition due to contact lens is actually corneal new vessels. That means on the cornea, usually the cornea is a very clear structure which you can't see any blood vessels in it. But sometimes when you wear a contact lens and your eye becomes too lack of oxygen, okay, the cornea itself may start to have new vessels growing into it like this. Now, this is not a good thing because all these new vessels, as they grow, they will make that area of cornea blur. That means your vision will be blurred. So this is obviously not a good thing to happen. And then this lastly here, corneal infection or corneal ulcer, which I have just shown you in the first in the first page at the corneal ulcer there. Okay, this is another case of corneal ulcer. So these are a few of the possible complications that may happen with contact lenses. Okay, so how do I reduce the risk of all these complications happening? Okay, here the number one rule. Okay, if you are a contact lens wearer, don't ever sleep overnight with your contact lenses. Okay, if you do this, your risk of getting the infection, the corneal ulcer, that's ear infection, the risk of getting that is up to 8 times higher. Okay, so don't ever sleep overnight with your contact lenses. And then before you handle the contact lenses, always wash your hands with soap and water. That means wash your hands clean before you touch your contact lenses. And remove contact lenses before swimming or showering. Okay, as water may introduce germs into the eyes. Okay, so no swimming or showering with your contact lenses. And then clean the lenses with their proper cleaning solutions and do not mix the old and new solutions in the case. Okay, because old solutions may already have some bacteria or contaminated already. So don't mix them with the new solution. And then you have to clean the lens case also, not just the contact lenses, but the lens case itself. You must clean it by rubbing and rinsing with the contact lens solution. And replace your contact lens case at least every 3 months. Although they may look very nice and new and clean, you must still replace them. Because as you use them, the surface may actually pick up embedded contaminants or bacteria which you cannot see. So no matter what, you must replace your contact lenses case every 3 months. And it's important to remember, if you are a contact lens wearer, Discontinue contact lens wear immediately if you have any redness in the eye, pain, blurring of vision, and you must consult your eye care provider. Okay, because any problems with contact lenses, it may lead to the last picture I showed, the corneal ulcer. Corneal ulcer is the worst thing that can happen to a contact lens ulcer because it can cause permanent blindness. Okay, so if you don't have anything, you don't have any problem, it's still a good idea to visit your eye care provider regularly, as often as recommended. Okay, the last method, or the second last method to correct the refractive error, is actually something called LASIK, which I'm sure many of you have also heard of. So in this LASIK, actually surgical lasers, okay, the use of lasers, surgical lasers are actually used to reshape the front curvature of the eyeball, namely your cornea, okay, to correct refractive errors such as short-sightedness or astigmatism, as I mentioned. This diagram I shown earlier already, okay. So in this LASIK, we just use lasers to change the curvature of your cornea here, so that the light can be focused accurately on the right spot on the retina. Okay, so that's called LASIK. Using LASIK lasers to actually reshape the cornea to refocus light accurately on the retina. Okay, and lastly, the last surgical method to correct your refractive error is something called your intraocular lens. Phakic intraocular lens is actually the full medical term. Okay, so these are lenses, artificial lenses, which can be surgically implanted into the eye to correct refractive errors like short-sightedness or astigmatism. Okay, now who are the people who will go for this procedure, intraocular lens implantation? These are usually those patients who are not suitable for LASIK. See, sometimes if your cornea is too thin or your power is too high, you may not be suitable for LASIK. So in such cases, if you still desire to be free from spectacles, then there's a possibility you may be able to go for this intraocular lens implantation. So these intraocular lenses, they can correct up to very high degrees of short-sightedness, 20 diopters, or layman term they call like 2000 power, 2000, and the astigmatism may be correctable up to like four diopters, or maybe what you call 400 degrees. Okay, so this is another method, basically for people who want to correct their refractive error but they are not suitable for LASIK. So this can be the last option for them. Okay, this one is just to show you the lenses, the intraocular lenses, which I just mentioned, which can be implanted in the eyes. So basically, it's divided into two types. One type is the one which is actually placed in front of your pupil like this here. This one you can see here. Here I've shown a particular example called the artisan lens. It's just one of a few varieties which are available. Okay, and then here is a picture of another type of this lens, but this one is actually implanted not in front of the pupil, but rather behind your pupil. That means it's behind your pupil and in front of the natural lens of the eye, as shown in this diagram here. So here is an example which I've shown, ICL, implantable collamer lenses. So both of these are just the two different kinds of intraocular lens which you can implant to the eye to correct your refractive error. Okay, so coming to another common eye disorder, again, what we call dry eyes. So this is, as I mentioned, a very common problem in all age groups. All age groups. Okay, so dry eyes. Why do we actually? Why is dry eye a problem? Okay, it's because tears are very, very necessary. Okay, tears keep the eyes comfortable, protect from infection, and it actually facilitates your clear vision. The tears will form a very clear, smooth, reflecting surface on the cornea so that light can be refracted and focused properly instead of being scattered everywhere. So the symptoms of dry eyes, of course, number one, of course, you will feel the dryness. Okay, it may be dryness, maybe burning sensation. You may feel foreign body sensation. You feel like there's something in the eye, it feels pretty. Some people may even experience itchiness, and some may be like tiredness. They cannot read for long, they read for some time, then they start to feel very tired, the eyes. And some people may experience photophobia. That means they have glare. When there's strong sunlight or when they drive at night, they cannot stand the oncoming car headlights. They'll feel very glaring. Okay, and some people at dry eyes, they feel very sensitive when the wind blows or when there's smoke. Okay, some people with dry eyes, they find it's very difficult to wear contact lenses. They put the contact lens in and they feel very uncomfortable. Okay, so one of the common signs you see in dryness is actually, as I showed in this diagram here, what you call, I showed earlier as well, it's called corneal dot erosions. That means there are many punctate or dot-like erosion on the surface of your cornea here. See, in this particular case here. So this is obviously going to cause a lot of discomfort. It will cause glare. And if these dot erosions are quite a lot and they involve even the center part of the cornea here, you also have quite bad blurring of vision. So the symptoms again is, as I mentioned, this is just in diagram form, dryness, itchiness, burning, watery eyes. Yes, sometimes even though it's dry, but you may experience the opposite. You may experience watery eyes. Because when the eye is too dry, there's something called a reflex secretion, a reflex watering. That means that when the eye feels that it's too dry, it tries to protect itself by suddenly producing more tears. So you have dry eyes, sometimes the reaction may be actually watery eyes, but it's actually caused by dryness. Okay, sensitivity to light or even blurry vision. This is of course due to the erosions on the surface of the eye, cornea, and then problems wearing contact lenses. So what triggers these eye symptoms? Okay, what will make these dryness symptoms come on? Dry, windy conditions. Sometimes if the air is overheated or overcooled, example like air conditioning, the air is very dry and cold. Yes, you will feel the dry eye symptoms more. Then when there's like sunlight or smoke, and if you wear contact lenses, it will worsen the symptoms of dry. And here, yes, something which is very common nowadays, extended screen time on your computers, mobile phones, tablets. Okay, so all this, you use the eyes more for concentrating and all that, your eyes will also feel you have more symptoms of dryness. And some certain medications actually can also cause dryness of the eyes. Now, what is the significance of this dry eyes? It's something which is like, it sounds trivial, but actually it can actually cause affect your daily activities. So if you have dry eyes, obviously you cannot concentrate or watch TV or computer for an extended period of time. You'll feel very, very fast, the eyes will get tired and uncomfortable. Okay, reading, of course, also you cannot read for long. And driving, if you have dry eyes and you're driving, you're concentrating straight ahead, your eyes are open wide, the air conditioning is blowing your eyes, there's strong sunlight. If you're driving in the afternoon, there's sunlight. If you're driving at night, there's light from the oncoming headlights of cars. So all this will make your dry eye symptom worse and interfere with all these activities. So who will suffer from these dry eye symptoms? Basically, anybody, as I mentioned just now, all age groups are actually affected, right? But some people, they are more predisposed. Okay, here, women are more likely to get dry eyes. Why? Probably because of hormonal changes, including menopause. Okay, age, as I mentioned, is one factor. Although all ages are affected, but over 50, your risk of getting dry eyes is probably a bit higher. Asians also, they tend to be more affected by dry eyes, okay, compared to Caucasians, maybe because of our eye structure and also because of our climate. And then long-term contact lens wearer, yes, people who wear contact lenses, as I mentioned, under contact lenses, one of the complications actually is dry eyes. Okay, medication and certain health conditions. Sometimes some medications, like even certain anti-hypertensive medication, or even some maybe birth control pills, or some pimple medication, like retinoids. All this may cause dryness. Certain health conditions, maybe like even something as simple as diabetes, also may cause dryness. Or certain a bit more rare health conditions, such as like what they call connective tissue disorders, like SLE. All these can actually have eye dryness as one of their quite common symptoms. Okay, so dry eyes, is it dangerous? Yes, it can be. Okay, dry eyes can cause complications. Okay, so as I mentioned earlier, tears protect eyes from infection. So if you don't have enough tears, yes, there is a risk you may get eye infections, especially if the dryness is very severe. Okay, so if you don't have enough tears to protect the surface of eye, then you can have damage to the surface of eye, the cornea here. This is example here. Because of severe dryness, you have all these dot erosions here on the cornea. So whenever there are erosions on the cornea, bacteria can actually enter into the cornea. And in a very bad case, a worst case scenario, you will end up with this, which I already mentioned twice just now, a corneal ulcer. Okay, this will heal with scarring. Okay, and of course will cause permanent damage to the vision. And then dry eyes, of course, if it's bad, it can actually decrease or affect your quality of life. You find it difficult to read, use a computer, or drive at night. So how do you manage this problem? Dry eyes, a very common problem. Well, there are simple things that you can do yourself. Okay, lifestyle and environmental modifications. Okay, that's why I mentioned there are certain conditions or environmental factors that can actually make the dry eyes worse. So you can avoid or reduce all those activities which worsen dry eyes. For example, you can reduce the hours of contact lens wear. Sometimes you may be able to reduce your use of gadgets. Then maybe try to avoid long hours in air conditioning. Okay, these are some of the things that you may be able to do. Okay, and the other simple thing that you can do is actually you can just use lubricating eye drops or what they call artificial tears. Okay, so these are actually very useful as a tear substitute. You don't have enough tears, you just supplement with artificial tears. Okay, then lid hygiene, warm compressors, all this will help to all this will help to what they call increase the oil content of your tears, so that if there's enough oil in your tears, then the evaporation will not happen so fast to the tears in the eyes. Okay, and then if the dry eyes is actually quite bad and actually require active treatment, by an eye specialist, then for the associated inflammation and other things, or medications like topical steroids, cyclosporine, okay, or even antibiotics in the presence of infection. Okay, all this may also be used. Other measures are like I'll just mention this, just puntal plugs, okay, meibomian gland expression, and intense pulse-like application. So all these are for more severe dry eyes, where it's not relief with just your lubricating drops. Then obviously when you come to the eye doctor, then all these are other options to treat. Okay, leading on from the dry eyes, another also a very common problem nowadays, especially in this period of working from home. Okay, so this is something called digital eye syndrome, or in more easier to understand terms, computer vision syndrome. Okay, now this is actually caused by prolonged hours of computer use or use of other digital devices or gadgets, even your phone or your tablet. Okay, so what are the symptoms? What actually is in this, what they call syndrome? So the symptoms are tiredness of eyes. Generally, you feel the eyes are very tired. Then you have dry eyes as well, dry, burning eyes. And then difficulty focusing after some time. You start looking at your computer for maybe the first half hour, it's fine. After that, then you start to feel that it's very difficult to focus. Okay, the words start to appear like blur or maybe double or like shadow, like there's a shadow or another image on the outline. Okay, then if you have been looking at the computer for some time and then suddenly you look up from the computer, you may feel that your distance vision is blurred, temporary blurring of distance vision. You feel that when you look up from the computer, you need maybe a few seconds or maybe a minute or so to actually be able to focus on the distance again. Okay, and then you also may suffer from headaches, or even your neck or shoulder may start to ache. So all this collection of symptoms, they are all under what they call computer vision syndrome. Okay, so what causes this computer vision syndrome or this digital eye strain? Okay, basically the main thing here is actually tiredness of the eyes focusing muscles. Okay, the main cause of this tiredness is actually accommodative fatigue, or tiredness of the eyes focusing muscles. So when we look at something near our eyes, we have these accommodative muscles, or what you call the ciliary muscle, which actually needs to work hard to focus your vision for the near distance, for the near distance. So for long hours of focusing at near, this accommodative muscle will become tired. So when the muscle is tired, obviously they will stop working well. Okay. And near work, when you look at near things, this also requires both your eyes to converge. That means when you look at something near, your two eyeballs must actually come closer to each other, okay, so that they can focus more accurately on what's in front of you, just in front of you. So this also causes the eye muscle fatigue, okay. And people above 40 years old, they may start to have presbyopia, what they call LOFA, okay. So if they are always looking at if they're using their near vision always like for looking at computers or tablets, and they don't wear the proper glasses for reading, then this will of course increase the eye strain, okay, and it will contribute even more to the digital eye strain, okay. So if you have problem looking at near because of the presbyopia or the LOFA, then you should actually wear the proper near glasses. Okay, so this is dry eyes is another component of this computer vision syndrome. Why do we get dry eyes when you look at computers for some time? Okay, when you are concentrating while reading or working on a computer, automatically our eyes blink less often. Okay, normally in normal circumstances, like let's say when you're relaxed, when you're just having a casual conversation with somebody, your eyes are actually blinking every few seconds. So every time your eye blinks, the layer of tears inside gets refreshed. Okay, so your eyes will remain moist for a longer period of time. But when you are concentrating on something, for example, on your computer or reading, automatically during the period of concentration, we tend to blink less often, maybe even once on every 10 to 15 seconds only. So the longer your eyes remain open, of course, the faster tears will evaporate from your eyes. Okay, so now when you look at computer, of course, you're looking straight ahead. So when you look straight in front of you, your eyes will also be more widely open. So if your eyes are more widely open, then of course the tears will evaporate faster because of a larger surface area, okay? And then air conditioning, of course, the air is very dry, so this also worsens dry eyes. Okay, so this is how your computer vision syndrome will cause dryness. So what can we do about this? How do we reduce this so-called computer vision syndrome? Okay, here well, of course, the definitive thing to do would actually be to try to reduce our screen time, which sometimes may not be possible because of work or study constraints. Okay, so what you can do, a simple thing is something called the 20-20 rule. Okay, 20-20-20 rule, sorry, 3 20s here. Okay, this is actually easy to remember. Every 20 minutes, look away at something 20 feet away for 20 seconds. Okay, why? Because when you're looking near at your computer, your accommodative muscle in the eye is working very hard, focusing at the near distance. So every 20 minutes, if you look at something far away, 20 feet away for 20 seconds, when you look at something far away, your accommodative muscles have some time to relax. They relax and they're able to rest at least for 20 seconds. So this is actually very helpful. So it decreases their tiredness, so they can actually work better and more regularly. Okay, and this is something here which, if you can remember, you can actually like consciously remember to blink your eyes regularly when you're working at a computer, or even more definitive is actually to use lubricant eye drops. Just purchase some artificial tears and then you can use it liberally, because artificial tears usually they do not have any kind of side effect, so they can be used long term and very frequently, especially the preservative free type. Okay, so that's another thing you can use artificial tears, lubricants, if you are if you use the computers a lot. Okay, the other thing is positioning of your computer monitor. Okay, so your computer monitor should be positioned at a comfortable distance, not too near, not too far. This generally is about 20 to 40 inches away. I think you can try yourself and see which distance is most comfortable. And another important thing actually is that the top of the monitor, that means the top edge of your monitor, your screen, should be at the level of your eyes. Okay, so if the top edge of the monitor is at the level of your eyes, automatically when you look at the center of the monitor, you are actually looking down about 15 degrees. Okay, when you look at the screen. So actually, as we found that this angle of near vision, this angle of near vision, 15 degrees down, is actually the most comfortable and to reduce the fatigue of your eyes when you're looking at something near for a prolonged period of time. And then sometimes there are certain so-called computer glasses which they actually aid in focusing at a particular distance. Okay, like some people, they are in the age group where they start to have a bit of LOFA, and then they find that sometimes the computer may be a bit too near, so they can actually get some corrective glasses to actually help to reduce eye fatigue. Okay, and some of these computer glasses, they may not have power in them, but they have actually anti-reflective coatings, which also reduce the glare from the computer. Okay, so they also go a long way in reducing your symptoms. Okay, something also quite common is many of us will have at some time in our life experienced redness of the eyes, red eyes. Maybe one eye is red or maybe both eyes. So red eyes, well, very often red eyes is caused by something they call conjunctivitis. In fact, if you have red eyes and you go to the doctor, especially the normal general practitioner, many times they'll tell that you have so-called red eyes, and they'll prescribe you some drops. Okay. Now the thing here is that you have to know that actually red eyes is not always honganjing. It's not always just conjunctivitis. There are actually many causes for red eyes, and the causes may be very simple, non-serious conditions, but it can also be very serious, blinding conditions. Okay, so this is what you have to be aware of when it comes to red eyes. Okay, it may be something very serious as well. Now, non-serious conditions, as I mentioned just now, is infective conjunctivitis, or what you call honganjing. This one is, yes, it can cause a lot of discomfort and all, but usually there is no dangerous complications and it will recover quite fast. Okay, sometimes even redness can be caused by some simple maybe eye allergy, or even just a bad case of dry eye. Sometimes if your eyes are very dry, yes, it may also cause some redness. So these are all the not so serious complications of this red eyes, not so serious conditions. Now, serious conditions, red eyes, yes, this can include what we call acute glaucoma. Okay, this acute glaucoma, and something else is the corneal ulcer. Corneal ulcer, again, 3 times before this I've shown you, is an infection of your cornea, which can leave a very bad corneal scar and cause permanent blurring of vision. So now I will just illustrate with some pictures here again. So here again, non-serious causes of red eyes. Example, honganjing, infective conjunctivitis. Here you can see the eye is red, but usually the hallmark, the main thing about this infective conjunctivitis is that usually, or I would say most of the time, there is actually discharge in the eye. You can see here, there's discharge in the eye. Redness of the eyes, discharge, very, very likely is honganjing, infective conjunctivitis. Eye allergy, yes, there's also redness. The main symptom actually is itchiness. And eye allergy is usually quite a chronic problem. It's not just like a few days. Usually it will be like quite a long period of time. Your eyes will always be itchy, or it may be okay for some time, but it's always recurring. It's always coming back. Okay, and it's always like the main symptom is itchiness. So eye allergy is another so-called non-serious cause. Okay, what are the serious causes of red eye? Yes, okay, as I mentioned, this one acute glaucoma. So you can see in this condition, the eye is red as well, similar to your honganjing or your eye allergy. But in this case, it is a serious condition. It's something called acute glaucoma. They call. So glaucoma is a condition where the pressure inside the eye is too high. So if you don't treat this high pressure, if the pressure is very high, very fast, it can damage your optic nerve, the nerve of the eye. So this can actually result in permanent blindness. Okay, so as you can see in this condition here, the eye is red, but it's actually a very serious red eye. You need to get treatment as soon as possible. Another feature of this acute glaucoma is that most of the time, if you look carefully at the pupil will be mid-dilated. That means it's a bit enlarged like this. Okay, so this is another feature of the acute glaucoma, and this condition is very painful, and the patient will have very bad blurring of vision. So they have very bad blurring of vision and a very painful eyeball, as well as maybe headache on the same side of the head as well. This is the corneal ulcer, another cause of red eyes, another serious cause of red eye. Okay, so the eye is also red, but apart from that, there are many signs you can see here. On the cornea, you can see this white area, and if you look here, you can see something like a liquid level here. The yellow liquid inside. This is actually pus inside the eye, because the infection of the cornea is so bad that there are actually pus cells. Pus has already developed inside the eye itself. Okay, so this is corneal ulcer. So these two conditions are obviously very serious causes of red eye. So imagine if you do not recognize these two red eyes as something serious, and you just maybe go to pharmacy, treat it as Hong-An-Chen, just get some simple eye drops. Yes, you can actually, it may actually result in permanent blindness. Okay, so when is it very important to see an eye doctor if your eye is red? Okay, just roughly generally, if the eye is red and it's blurring of vision, that's definitely a very obvious danger sign here. Red and blur, you must see a doctor. It may be something as, it may be the acute glaucoma, it may be a bad corneal ulcer, okay? Pain, okay, this is another thing. If the pain it's very painful, especially if you also have headache along with the pain, this could be possible signs of acute glaucoma, okay? So again, red eye, pain, headache, you must see a doctor. If your eye is having severe glare, photophobia, that means when you look at lights, you just cannot stand it. It's so glaring, so uncomfortable. Okay, this could be an indication of something serious, serious cause of red eye. So you must also see a doctor. If you are a contact lens wearer, okay, this is very important. If you are a contact lens wearer, your eyes become red for whatever reason you think it is, you must see a doctor. Huh? Because red eyes in a contact lens wearer, there's a very high possibility it can be something serious as what you call a corneal ulcer, which I already mentioned many times before this, infection of the cornea. If you don't get that treated fast, you may actually end up permanently blind. If your eye is red and there's a history of trauma, you have just injured the eye is red, it may be any kind of trauma. It may be blunt trauma, as in you fell down, knocked against maybe the edge of a table, or maybe even someone had punched you in the eye, blunt trauma, or your eye has actually have a penetrating injury, something that's actually like step into the eye, or there's a chemical injury like battery acid maybe exploded, splash your eye. So any kind of trauma, eye is red, you must see a doctor to see any serious injury to the eye has occurred or not. So again here, just to remind you, because I feel this is very important, many cases of red eyes, they have potentially blinding consequences, okay? So early consultation and treatment, okay? Early consultation and treatment. It's very important to prevent permanent damage to vision. So remember, not all cases of red eyes are conjunctivitis. So not all cases of red eyes are Hong-An-Chen, okay? Sometimes even normal doctors, what they call GPs, sometimes maybe because of lack of experience seeing eye cases, and also because they do not have the proper instruments in the clinic to examine the eyes, they may actually miss these dangerous causes of red eyes, and they may mistakenly diagnose these serious causes of red eyes as something simple like Hong-An-Chen. So you may actually miss the early treatment, and your condition may develop into something very serious. Okay, and do not rely on over-the-counter eye drops. You got a red eye, do not go to the pharmacies and tell them, hey, what do you think this is? Can you give me something? Well, many times they may be wrong, and they may give you the incorrect medication, which may actually have dangerous side effects or worsen your condition. Okay, so another very common, or I would say universal thing, disorder is actually something called presbyopia or LOFA. So actually here, the common disorders, I'm actually trying to go cover all ages. So just not the problems I mentioned, they are basically for all ages, but also for the maybe the younger age group. So now we're coming on to the maybe the middle age group. Okay, so something called LOFA, presbyopia. So usually this begins around 40 years old, maybe some people like 38 plus or 40 onwards, yes. Okay, so that's the time when people start to have blurred vision for near, when you're reading or when you're working at the computer. So around this certain age here, some people, they start to feel it. When they look at near things, it's not very clear. They feel very strange, very strenuous. Sometimes they feel that they have to hold the handphone a bit further away from their eyes. Then only you can see clearer. And even if you have a short-sightedness, you will still notice that your near vision is blurred when you wear your usual glasses or contacts to correct your short-sightedness, you correct your distance vision. Usually, if you're short-sighted, when you take off your glasses, you can see things very near to you, okay? Because short-sighted means that your vision is always focused at a very near distance in front of your eyes. But if you wear glasses, to correct your short-sightedness. That means when you have glasses on, you're no longer short-sighted. And if you have the glasses on and you are around this 40 years old group, then you find that when you wear your short-sighted glasses, when you look at your phone and all, it may start to become a bit difficult. That's an early sign of this LOFA, short-sightedness. So here in this picture is illustrated. See, in a patient with this LOFA, the distance vision is actually fine. Far is clear, okay? I mean, if the patient has got no short-sightedness or sankong or anything else, so distance is very clear. You can see the buildings all very nicely, the outline. But when they look near, you see, they can hardly see the words. The near vision is very blurred. So this is LOFA. So this patient is starting to have LOFA. That means the vision is blurred for near. So the symptoms, okay, as I mentioned, is actually blurring of only your near vision. So tendency to hold the reading material or handphone further away at arm's length. So usually if they don't wear glasses, they need to hold the phone a bit further away. Okay, because the near vision is has become quite bad, but the distance vision is better. So if they hold it a bit further away, it tends to help a lot. Then if they don't use the glasses, they will keep straining their eyes when they look at the near things, reading all that. So they may experience headache, strain, eye strain, or fatigue on prolonged use of the near vision. So what causes this presbyopia? So this is something which unfortunately happens to everybody sooner or later. Okay, you just can't escape it. Okay, as long as your age will increase, you will eventually have this problem. So this is actually, yes, age-related changes, okay, causing decreased elasticity of the lens. So the lens in the eye, I mentioned earlier, the function actually is to focus the light that comes through. Okay, so as you grow older, this lens becomes less elastic. That means the shape of the lens is less able to change the shape to focus for near and distance objects. See, when you're looking at something near, basically the lens has to become a so-called factor like this. Okay, when you're looking at something further away, then the lens can be, they need to change the shape to become thinner like this, okay, to focus the light accurately. So when your age is decreased, is going up a bit, this lens, it becomes less elastic. So it's the ability to change shape will be less really. So it's more difficult to focus for near. Okay, so that's one of the things that causes your presbyopia. The other factor here is the muscles. This muscle, the shape of the lens is actually adjusted by this muscle, a circular muscle surrounding the lens, what we call the ciliary muscle here. So as you grow older, this lens, the muscles also experience some degenerative changes, okay, and they also become weak. So this also causes the lens shape to be not so able to adjust itself. So these are the two factors, basically age-related changes that cause your LOFA, the presbyopia. So how to correct it? You will need something in front of the eye, most commonly reading glasses, okay, glasses to actually help to focus the eye for near like this. Okay, so this LOFA, as I mentioned, is something that happens to everybody sooner or later. Some find it quite a problem. Whenever they want to look at their phone, they have to like go and look for their reading glasses, okay? So how do you correct this presbyopia? Okay, as I mentioned, and most common way actually is reading glasses. Or sometimes some people, they wear multifocal glasses. Multifocal means that maybe they have short-sightedness, so they have the glasses which correct for distance, but in that glass itself, they also have a part of the glass which can correct for their LOFA in the same pair of glass. So that's called a multifocal glass. Okay, some people, they practice something called monovision. Okay, you can do this monovision with either contact lenses or even LASIK. So in this monovision system, one eye is corrected for distance vision, either using your contact lens or LASIK. You correct one eye fully. That means one eye, you correct the short-sightedness or whatever power there is, you correct it fully. So that eye will have very good vision for distance. Okay, but the other eye, you correct it, but you leave a certain amount of short-sightedness there. Okay, because when you have short-sightedness in the eye, that eye can focus and see near. So if that eye, the other eye, you leave a bit of short-sightedness, the person can use that short-sightedness to focus on near things like for reading, looking at the handphone or reading, okay? So that's monovision. That means one eye sees far clearly, another eye sees near clearly. So that's called monovision. You can achieve this either using contact lenses or using LASIK, okay? Now the other method, the last method to correct your presbyopia is actually surgery, actual surgery itself. do implantation of multifocal intraocular lens. Okay, this can be done either as cataract surgery. Some patients, they already have a cataract eye, so they can have the cataract removed and implant this multifocal lens to correct their LOFA as well as their distance power. Or some patients a bit younger may not have cataract yet, but maybe they are not, so they don't like glasses. They are not very keen on this monovision method. So they may opt, or they may choose to actually remove the natural lens of the eye and implant a multifocal intraocular lens to correct their LOFA. So this is also another possibility, another method. Okay, coming to something which is also quite common, which we doctors very commonly see in our clinic, which actually is forms a big part of the patients that we see, is something called glaucoma. So glaucoma, or 青光眼 in Chinese. So this is a condition where the pressure of the eye is too high. Okay? So the eye itself has got pressure. It's just like we have blood pressure. So blood pressure can be high. We need medication to control it. Similarly, in the eye, we have something independent of the blood pressure, but we have something called the eye pressure, intraocular pressure. So the eyeball itself has got some internal pressure inside. So when the internal pressure of the eye is too high, this is a condition called glaucoma. So if the pressure of the eye is too high, you don't treat it, it can cause progressive, irreversible blindness. Okay, because damage occurs to the optic nerve. Optic nerve is actually this large nerve at the back of your eyeball here. This large nerve actually, it carries the signals from inside your eye, from the retina. It carries the signals all the way to the brain, okay, to interpret the images, to let us know what we are actually looking at. So obviously this nerve is very important. If this nerve doesn't function, you are actually blind. Okay, so if the eye pressure is too high, glaucoma, this nerve here gets progressively damaged. So this will lead to progressive, irreversible blindness. Yes, it's irreversible. Okay, if you don't treat it, the blindness that develops is irreversible, cannot be recovered. Okay, damage occurs to optic nerve, as I said here. So what happens is that in the glaucoma eye, the internal pressure is too high. So this internal pressure will act, the high pressure will act on, compress on this optic nerve behind here. So as time goes on, you see a large cavity has formed here. This large cavity is where all the retinal nerves, the nerves has actually died off, leaving just empty space here. Okay, so this is how you progressively lose vision in glaucoma. So who can get glaucoma? Is there any cause of it? Any risk factors? Yes. Risk factors or causes for glaucoma. Okay, age itself is a risk factor, usually over 40 years of age. Okay, and then this is quite a significant risk factor here. If you have family members with glaucoma, okay, so there is a hereditary factor, be it your parents, father, mother, your brothers, your siblings. Okay, okay. If you have family members with glaucoma, yes, your risk for having glaucoma is probably higher than the general population. Okay, if you have short-sightedness, especially very high short-sightedness or even far-sightedness, this can also be a risk factor for glaucoma. Okay, so highly short-sightedness or far-sightedness, yes, it may be higher risk of glaucoma as well. Diabetes, yes, people with diabetes, they may have as high as maybe 50% higher chance of having glaucoma as well, possibly. Okay, and if an eye has had an injury before in the past, there is also a higher risk that that eye may develop glaucoma as well. And yeah, Asian people, and again female sex, there's also higher risk of developing a certain type of glaucoma called angle closure glaucoma. Okay, this is probably related to the fact that Asian people, and especially females, they tend to have smaller eyeballs, shorter eyeballs, which will actually predispose to having this type of glaucoma called angle closure glaucoma. This is actually the acute glaucoma, which I showed earlier on, one of the pictures there. Okay, chronic use of steroid, oral medication, or eye drops. Sometimes some people, they have some medical conditions that require them to always use steroids. If they use steroids for a prolonged period of time, there is a possibility they may also develop glaucoma, because one of the side effects of steroid is actually glaucoma. And even steroid eye drops, yeah, steroid eye drops also have quite a high risk of causing glaucoma. Some people, they may have certain eye condition that require them to be on steroids for a long time. Or there are even some people who self-treat themselves. They have eye discomfort, eye redness. they go to pharmacy, they just purchase a steroid eye drop and they find it's very good, it makes eyes comfortable, they use it for some time. Yes, that also can cause glaucoma. So that's another reason you should not go and treat yourself and buy eye drops by yourself to use. And then glaucoma can also be caused by other eye conditions. Sometimes, yes, cataract. Yes, sometimes cataract, if the cataract is too, is very mature and you don't do anything about it, yes, eventually it may lead to, it can cause glaucoma as well, secondary glaucoma. And then certain kinds of eye diseases like intraocular inflammation, yes, if it's not treated, it can also lead to glaucoma as well. So there are a few things which can actually predispose to glaucoma here, okay? Now, although there are those causes which I've shown you, so the thing here is that many times, how will I know if I have glaucoma? Actually, you won't. Most of the time, you will not know. Because usually glaucoma, the most common type of glaucoma, it has no noticeable symptoms in the early or even in the intermediate stages. There's no pain, or it can be said that there's not even blurring of vision. Okay, most people, they still see quite well. Why? Because glaucoma typically destroys your sight vision first, initially, okay? Only when the central vision starts to be affected, that's the time that the disease is already very advanced. Visual loss is permanent, okay? And treatment, if at that stage you discover the disease, any treatment that is started can only try to prevent further loss of vision. Whatever vision is lost, it cannot be regained. Treatment only prevents further loss of vision, okay? So here, in this pictures here, I'm going to just show you what I mean. Normal vision, can see this patient has a full field of vision. They can see every aspect of this, this scene here. In early glaucoma, at first glance, vision, you think, yeah, it's probably the same as the top picture, right? But if you look closely, can see that certain areas of the sight vision has actually become dark or actually has been lost already. Because as I said, early stages, the glaucoma typically destroys your sight vision first. So early glaucoma, can see the sight vision is the one that goes first. Usually at this stage, people don't notice, they don't realize why. Because whenever you look at anything, we are using our central vision. We tend not to notice what's going on at the edges of the vision, you see. So as the glaucoma progresses, you see more sight vision is lost. More sight vision is lost. Now, at this stage, probably quite a lot of people will notice something is wrong already. Okay, now, if you still don't get treatment, it progresses some more in this extreme or very serious glaucoma, you can see that you have something called tunnel vision. When you look through it, it's basically looking through a tunnel. It's that you're standing at one end of the tunnel and looking through it, or maybe you're looking through a telescope, you can just see this central area as well. The sight is all dark, nothing registers there. Okay, so this is extreme glaucoma. So usually at this stage, many people, they know something is wrong. Then they come and see the eye doctor. And at that stage, if this is due to glaucoma, then very sorry to say this is not reversible. But yes, if you start treatment, it can prevent further loss of vision. So the thing here is that early detection, of course, is very, very important. If you can detect the glaucoma at this stage here of normal vision, or even at this very early stage, then you can save yourself from going on to this. You can save yourself from blindness, basically. So since it has got no symptoms in the early or even the medium stages, so obviously the way to go is actually early detection, is actually by what they call screening. That means you don't have any symptoms, but you come for an eye checkup anyway, especially if you think that you have those risk factors which I mentioned early on, especially if you have a family history of glaucoma, your parents, your siblings, your auntie, grandfather, uncle, whoever, then I think it's a good idea, just come for screening. Okay, here cataract, yes, this is also again a universal problem. Everybody, as long as you grow old, everybody sooner or later will develop this cataract. Okay, so what is cataract actually? So as I mentioned in the my first slide, I showed the structure of the eye. In the eye, there is a lens, a natural lens in the eye, okay, which helps to focus light onto the retina. Now, cataract means that your natural lens has become opaque, what you call opacification of the natural lens. Okay, so this is a very severe case here. You can see the lens, instead of being nice and clear like this, it has become cloudy. In this case, it has become white. White is a sign of a very, very mature cataract. So who gets cataract? What are risk factors or causes of cataract? Okay, here, remember aging. Aging is always the main cause of cataracts, okay? I would say 99% of a cataract is caused by aging. Okay, trauma. Trauma is something else which can also cause cataract. Okay, it can be blunt trauma, or it can even be something more serious like penetrating trauma. But even blunt trauma itself can cause cataract. And a cataract which develops from trauma may not develop immediately. It may develop sometime, maybe even years after the trauma. Okay, the other thing I mentioned just now also, chronic steroid use. Some people, they need to take steroid medication on a regular basis, long term. Some people, they need to put steroid eye drops over a period of time. So all this may also cause cataract, okay? Diabetes, if you have diabetes, yes, there's a higher likelihood of you developing cataract, especially at a younger age. Other more rare causes are like ionizing radiation. If you're exposed to radiation or electrical shock, okay, you may develop cataract. And some cataracts, they are congenital, that means inborn. Some babies, they may actually be born with cataracts. So example here, this cataract I chose to show you is because it has got a very interesting shape. You can see it's actually like a flower or a star. So medically, it's called a stellate cataract. When you see a cataract like this shape, I would say 99% of the time is due to trauma, blunt trauma. Okay. Okay, so if I see a cataract like this, I will immediately ask the patient, have you had any eye injury before? And most of the time they will say yes. Or even if they say no, probably it occurred when they were very young, they had maybe forgotten about it. Here is an example of inborn congenital cataract here. So yes, cataracts may even be an inborn problem. But by and large, most commonly, this is the main cause, aging. Okay, so what are symptoms of cataract? Yes, cataract does produce more symptoms than glaucoma and earlier as well. So the classical symptom of this cataract is what we call painless progressive blurring. So the vision occurs painlessly. You don't feel any pain or anything. You just feel that it becomes blur over a period of time, progressively blur. Okay, painless. Another common way a cataract can present is that you notice that change in your glasses power. Okay, usually for adults, the eye power is already very stable. Okay, there's no need to like change your glasses every year or every 2-3 years. Okay, now if you have reached a certain age, like let's say maybe like around 50 or after, and then you find that recently my eye is, even I wear glasses, my vision is not very good. I go to the shop and they say, oh, your power is different now. Maybe it's increased, so you get a new pair of glasses and you're seeing fine. Then maybe 6 months, a year later, you find, again, my vision is not very good again. You go back to the optician and they say, oh yeah, your power seems to have increased, probably you need new glasses. Okay, if you are at this age of 50 and above and your power has suddenly become unstable, very high likelihood you have developed a cataract, okay? So you may change glasses, and at one stage you'll feel that even with the new glasses, your vision is still not satisfactory. So you know something is up. So sometimes the cataract can also cause glare. You find that the patient may find that when they drive at night, they find that the car headlights are very, very glaring, and they will keep flashing the other car. They think that the other car is they're purposely putting on their high beams and all that. But it may not be so. It may actually be because they have cataracts, which make the eyes very sensitive to these headlights. And some people, they complain that, everything seems so dark. When they go around the house, they have to keep putting on the lights. They have to keep switching on the lights. They feel that everything is so dark. So vision worse in dim lighting. That's possibly also cataract. Some patients, some people, they notice in one eye they can actually have double vision. I've had patients who come to me and say they sit in the car at the traffic light, and then they'll notice when they close one eye, they see like 2 red lights, instead of 1 red light in one eye. That's also possibly, highly possibly is a cataract. And then some patients, they say colors appear faded or washed out, just like here, see? So this is normal view. A person with cataract, they may feel everything is misty. Colors look very faint, washed out, pale. Okay, here is a patient that when they drive at night, very comfortable. They just see lights, but there's no glare. But a patient with cataract, they may have all these starbursts, severe glare coming on. So much so that if it's so bad, they might not even be able to drive if there are car headlights shining into the eyes. Okay, so what if cataracts are not treated? Sometimes I have patients coming to me, I tell them, okay, you've got a cataract. Then they say, oh, well, at the moment, it's not very convenient for surgery. I'm too busy, or it may be some other cause. I think I'll just leave it alone for a while. My other eye can see very well. So they just go off and then they don't come back for years. Now, what happens if they have a cataract and you don't treat it? Well, not only will the vision get worse and worse as the cataract increases. Okay, sometimes if the cataract is too advanced or mature, it can cause other problems for the eye. One thing here is it can cause glaucoma as well. Glaucoma, I just mentioned just earlier on. Okay, so sometimes if the cataract is too bad, it may cause secondary glaucoma. Okay, glaucoma, as I told you just now, it can cause permanent visual loss. Okay, and then sometimes a very mature cataract can become too heavy. Okay, the cataract has become very nice and fat. It's so heavy that the eye can no longer it cannot be supported in the eye anymore, and it may just drop. See, like this cataract here, you can see. Okay, it has actually dropped into the back part of the eye, into the vitreous or into the retinal area of the eye. So obviously you need to remove it, because if you don't remove it, it's going to cause a lot of inflammation or even physical damage to the retina, because it's sitting in the back space of the eye there. Okay, so if it has come to this stage where the entire cataract has actually dropped behind into the back space of the eye, yeah, it's not going to be a simple cataract surgery. The surgery will be much more complicated. Okay, and usually at this stage, if there's already some damage to the eye, vision may not be satisfactory restored even after surgery. So here again, cataract is a condition that you should not just leave it alone. If you don't think it's convenient to get it treated at the moment, then you must also follow the doctor's advice in attending regular follow-up, and not just leave it alone for years. Okay, so treatment, yes, cataract, how do you treat this problem? Okay, it's actually quite straightforward. You definitely need to get it removed, surgical removal of cataract, and then you need implantation of an intraocular lens, okay? Because cataract is actually the normal natural lens in the eye has become cataract. So when you remove this natural lens or this cataract, obviously you will have to replace it with an artificial lens. Otherwise, your eye will not be able to focus on images after the surgery. So here in just 4 short steps, I just very briefly explain to you all. So the most common method of treating cataract nowadays is something called phacoemulsification. So that's basically using ultrasound energy to actually break up the cataract, and at the same time, so-called suck it up or aspirate out the cataract. So this is done through a very small incision, maybe like a bit more than 2 millimeters at the edge of the cornea. Okay, and then through this surgical incision here, the instrument, what they call the phacoemulsification probe, is actually inserted, and this the tip of it is actually delivers ultrasound energy, and this ultrasound energy is the one which actually what they call emulsify, or just like break up the entire cataract progressively, and at the same time suck out the remnants of cataract. Okay, so once the entire cataract has been broken up and sucked out of the eye, leaving behind this empty bag in the eye, that's when we can implant this intraocular lens. This is how the lens looks like. So through this 2+ millimeter incision, this lens is actually implanted into the original position of the cataract. Okay, and once it's implanted in the eye, it unfolds and it's very stable inside this original position of the eye, of the cataract itself, of the lens itself. Okay, so that's basically the 4 steps of the surgery. Typically, this surgery, it can be just as fast as maybe 10 minutes, 10, 15, or maybe 20 minutes. So yes, I mentioned that you have to implant lenses. So what are the types of lenses that you can implant? Generally, broadly, 2 types are available. Okay, the first type is monofocal. Monofocal means that this lens, if you choose to implant this monofocal lens, this lens can correct your vision for distance only. That means after surgery, you have good distance vision. You can see distance very well, like driving a car, watching the television. You can do it very well without glasses. But when you try to read, you will need reading glasses. So monofocal lens, you will need glasses for reading. Multifocal, as the name implies, means that this lens, it can focus at various multiple distances, far, intermediate, near. So this multifocal lens, if you choose to implant it, it can correct your near vision, your intermediate vision, like for computer use, as well as your distance vision. Okay, and then for some people with San Gong, yes, there's also a toric version here. Toric means San Gong. So for those people with San Gong, this, if they choose this toric version of these lenses, it can correct the San Gong as well. Okay, another condition which is also very common in the age group. So it's called age-related macular degeneration, okay, AMD. So in this condition, usually the person will have to be at least 50 years or older. And in this condition, they have abnormal blood vessels growing in the macular area of retina. So this is your retina here. So retina has got many blood vessels, okay? So in this AMD condition, the retina, they start to grow abnormal, unhealthy blood vessels. So these unhealthy, abnormal blood vessels, they can cause swelling, bleeding, and at the same time, when they resolve later, they can cause scarring. So obviously this bleeding, swelling, bleeding, and scarring, they can cause permanent damage to your vision. Because if you leave them alone, you don't treat, it will obstruct vision, and when they eventually like resolve by itself, it leaves behind this scar here, which causes permanent blurring of vision. So this condition, obviously, since it causes so blinding consequences, early detection and treatment is very, very important, okay, to prevent permanent blindness. So how will I know if I have this AMD condition? Well, first, as I mentioned, you have to be at least 50 years of age or above. Okay, and the symptoms, it affects your central vision basically in the early stages. Early signs, you may straight lines. For example, you're walking or driving, you look at a very tall lamppost, you may notice that the central part of the lamppost seems to be like crooked or it's like bent like this, distorted. And then it's as the disease becomes more advanced, you may actually have a very obvious missing patch of vision, a black patch centrally in the vision like this here. Okay, because AMD is a condition which involves or affects your central vision mainly. So this is early sign, this is more advanced stage already. Okay, diabetes, and diabetes, as you know, is also becoming or is already a very common disease in our population. I think estimated at least like maybe 1 out of 4, people, they have diabetes, either they know or they don't know about it. Okay, so usually people with diabetes of maybe more than 12 years, more than 90% of them would have some degree of diabetic eye involvement. So diabetes is a disease that damages the blood vessels, okay? So it can damage all the small blood vessels in the retina. Retina has got very small blood vessels, okay? So when it damages your blood vessels in the retina, you can have swelling of the retina, bleeding, like this one here. And then in a very advanced serious state, you can actually have a type of retinal detachment as well. So it can also cause retinal detachment, okay? And sometimes it can also cause glaucoma. So you can see diabetic eye disease actually causes quite serious complications. This one is a picture of swelling of the retina here, retinal swelling. And the swelling usually involves your macula, the central part of your vision. So swelling will cause blurring of vision, of course, usually a more progressive kind of blurring. And then bleeding, yes, bleeding causes more sudden blurring of vision, okay? Because suddenly the abnormal blood vessels, they burst, blood suddenly comes out, and the blood clot blocks the vision immediately. So usually patients who have this bleeding, they complain of a sudden blurring of vision in the eye. And because of all this severe bleeding, the growth of new vessels, everything, there will be a lot of scar tissue on the retina, and this over time will contract, will shrink, and they will pull off the retina, so you will progressively get retinal detachment as well. So all these things obviously is very detrimental to the vision. So symptom of diabetes in the eye. So actually I more or less already explained. Progressive blurring of vision because of the retinal swelling. Okay. Visual loss may happen suddenly. Okay, why? Because of bleeding, vitreous bleeding. Okay. Now this is very important thing here. The fourth point here. You have diabetes patients should never assume that just because they can still see well, they do not have diabetic eye disease. No. Okay, this is quite a common scenario. Many patients, they only come, many diabetic patients, they only come when they are blurring of vision, when they have suddenly lost vision. But the fact is that even before all this has happened, there are already early signs in the eye. Early signs of diabetes in the eyes, at that time, you can still have normal vision, but you just don't know that there's already diabetes in the eyes. So if at that stage, you still have good vision, but you attend just a normal screening, a normal checkup, just to make sure everything's okay, at that time, that doctor may actually detect that there are problems in your eye and can actually treat it faster to prevent it from becoming serious. Okay. Now this so regular eye checks are very important to prevent permanent visual damage. You have diabetes, don't wait until you can't see before you see eye doctor. Okay, regular eye checks is the way to go. Okay, so I've come to the end of this very long talk. Sorry for time. Okay, so the take-home message here is that for many eye conditions, early detection and treatment is vital. And then yes, another thing is in elderly people, very often they complain of blurring of vision, and very often their relatives or they themselves may think that it is due to cataract, and they can actually like go and see the doctor at a more convenient time. Now, the thing here to understand is that not all blurring of vision in elderly is due to cataract. Sometimes it may be something which requires urgent treatment, such as glaucoma, could be AMD, could even be diabetic eye disease. So if it's cataract, usually you can maybe wait a bit. But if it's those things like glaucoma and all, you definitely cannot wait. The longer you wait, the more permanent loss of vision occurs. Permanent loss of vision occurs. Okay, and lastly, of course, not all red eye is due to conjunctivitis. Red eye, as I mentioned, they have got very serious causes as well. Okay, so thank you very much for your time. If you have any questions, I will be most happy to try and answer you.
Wow, Dr. Lim.
Yeah.
Really loaded, not just only mosquitoes. Extremely loaded with a lot of information. I hope all our
try to cover most of it.
training all the audience to be doctors as well, is it?
Well, I hope I didn't bore them too much.
Okay, so I was just wondering, any of the audience would have any, I mean, our audience from our Zoom, if you have any questions, you can raise your hand and then you can unmute yourself to ask question. Okay, so if there's any, please raise your hand, yeah? Otherwise, I will go through the chats. Okay, there is one question, Dr. Lim, asking by Mickey Kang from our Facebook. If you see flashes of light, which are is it the beginning of a cataract?
Okay, flashes of light definitely is not a symptom of cataract. Flashes of light, I think I did mention under the floaters as now. Flashes of light actually means that there is they are starting to have some age-related degeneration of the vitreous gel in the eye. That means the gel has started to liquefy and to contract or to shrink. So when this happens, there will be some pulling or traction on the retina. So this traction or pulling on the retina is what causes the perception of the flash of light. So if you have these flashes, if you experience these flashes of light, that means that your vitreous gel is undergoing degeneration and contraction and pulling. So I think, yes, it is an indication for you to actually seek an eye examination, because as I mentioned, this pulling on the retina, the vitreous degeneration, it can actually possibly cause a retinal hole, and this may actually lead to retinal detachment as well. So yes, if you have flashes, you should, I would say, definitely need to get an eye examination.
Right, okay. So the next question would be from the Zoom. Can floaters caused by genetic, or is it hereditary or not?
No, floaters are not hereditary. Floaters, the most common cause of floater, as I mentioned, is something is related, is age related. It's actually age related. So it is not something hereditary because it's not an eye disease. It's just age related.
Okay, I have one question. Then would like stress or anxiety or even migraines that actually cause or related with floaters?
Stress, anxiety, migraines, no, they don't cause floaters. They have nothing to do with floaters.
Nothing to do. It's a separate issues.
Yes, it's a separate issue.
Okay. Mickey Kang have one question. Dr. Lim, how many times of laser can be done on one eye? For example, laser to remove cataract. Later on, laser may require to correct or repair the same eye due to eye problem.
Okay, laser, yes. The thing is that many procedures may be called laser to the layman, but actually not all of them are actually laser. For example, cataract, just now you mentioned cataract and laser. Actually, most of the time, the laser, that we do for cataract is not actual laser. There is an actual laser for cataract, but more commonly done for the eye is actually what we call phacoemulsification using ultrasound energy rather than laser. See.
Right.
So okay, that is actually not laser. That's actually ultrasound energy. The
Mm.
other type of laser, yes, there are other types of real laser that can be used for eye surgery. Okay, one of it is LASIK. That's a good example. LASIK to correct your, for example, your short-sightedness. That's actual laser. Excimer laser, femtosecond laser. Okay, then there are 4 other procedures. For example, just now I mentioned that there could be a retinal hole. Retinal hole, you'll need to do laser retinopexy. That's using a different laser that's called argon laser. Okay,
Right.
and then other lasers, for example, maybe something called a YAG laser. YAG laser is used for other things. For example, in certain types of like acute glaucoma, sometimes you may need to do a procedure called a peripheral YAG laser iridotomy. That's also a different kind of laser. Okay, so yes, and then sometimes for treatment of certain eye conditions like AMD, sometimes quite often we do a type of laser called this PDT, photodynamic therapy. So yes, there are actually many different so-called lasers which can be used to treat the eye.
Okay, so in simple words, Dr. Lim, I can summarize it as is actually different laser to treat different problems and
Yes,
has no
right.
relation. So it doesn't matter what laser and how many times an eye can be laser.
Yes,
The
correct.
lot
Yes,
is to treat and target the right problem using
yes,
the right
correct. Yes.
methods, right?
Yeah.
Okay, so I hope it answer Mickey's questions. So wondering any questions from the audience? If yes, if you want to ask in Cantonese, in Bahasa, no problem, you can do that, okay? This is a relaxed session, okay? So you can ask any questions with Dr. Lim. If you have, please raise your hand for the Zoom attendees. Okay, Dr. Lim, I have one question from our Zoom attendees. Bagaimana cara merawat masalah floaters melalui pemakanan? Is there any way that, like, food intake or supplements can actually help with floaters?
Okay, well, to be frank, actually floaters, as I mentioned, the only cause is actually age-related. And so far, there's no medical evidence that any kind of food or supplement can actually help the condition. Many times, actually, yes, patients, they go to the pharmacy and they say they have floaters, and then they actually get recommended some supplements, some even drops and all that. But actually, to be honest, they're not medically, there's no medical evidence that it actually helps. Okay. Because floaters, basically, you don't need treatment, nor is there any treatment actually. It's not a disease. And usually what I tell patients is that, yes, floaters, yes, initially they can be quite disturbing, quite distracting, but just ignore them after some time, maybe after a period of few months. Many people, they get accustomed to it. It's just like it's become their friend. So when they're accustomed to it, they're used to it, then they probably will not even notice it anymore. But only thing is they have to always be observant to watch out. If suddenly they have a sudden onset of a lot of floaters, they may be seeing like 1 or 2 floaters, and then suddenly one day they say, oh, why is there suddenly a big swarm of floaters has suddenly come out? They got to watch out. If they have such a symptom, suddenly a lot of floaters come out, that is possibly a symptom that there is a retinal hole in the eye. So they have to come and see a doctor as soon as they can. The other symptom is, yes, the flashes. I also mentioned that earlier. If suddenly they're seeing flashes, especially like very frequent flashes, that could also be a symptom that there is a hole in the retina. So these are the 2 things. Suddenly a lot of floaters, appearance of flashes of light. Yes, you must get an eye examination.
Just have to closely monitor on yourself, just to ensure that there's no sudden increase of the mosquitoes in your vision.
Sudden increase.
Okay, we have one Susie asking from our Zoom attendee. I have seen a mosquito flying all the time. Is there any way to cure it? I just want to top up from her question. Will it go away by itself, or will it, is there any way?
Okay, actually, once you have a floater, usually it's, as I mentioned, it will always be there. It doesn't go away. But sometimes some patients may think that it has disappeared because, as I say, after some time, you just ignore it. It tends to you get used to it, so you no longer notice it anymore. So you may think it has gone away. In some cases, as your age increases even more, the vitreous becomes even more liquefied. There's a possibility that that floater, it may like maybe shift to a different position, or it may just sink down, and yes, it may actually like sort of seem to have disappeared. That's also possible. But most of the time, in most of the cases, I would say once you have a floater, usually it's there permanently.
Okay, so we have one question from Michelle Low. Can you have one eye? That means one eye. Can you have floaters and flashes at the same time? Will they experience both at the same time?
Yes, that is also fairly common.
Fairly
Because,
common.
yes, because both these flashes and floaters, these conditions, they are caused by the degeneration of the vitreous jelly. So when the vitreous jelly degenerates, certain areas become liquid. So those liquid areas will cast shadow and make you see those floaters. And at the same time, as the vitreous jelly is degenerating, it will contract, it will shrink, and it will pull on the retina. So that sometimes causes flashes. So yes, of course, these two symptoms can occur at the same time. In fact, I have quite a few patients who come in with these two symptoms, or sometimes they may come with flashes alone, sometimes they may come with floaters alone also.
Okay. So long with these two symptoms and it is very frequent, then you just have to seek medical advice from the
Make
eye
sure that
doctor.
there's no retinal hole or detachment.
Right. Okay. So before we continue with the Q&A, my team have actually posted the free eye screening. So for all the attendees who are actually entitled with a free eye screening with Dr. Lim, including consultation. So you can click the link from our Facebook page later. The registration link will be open until tomorrow by 5 p.m. So you can do the registration for the free eye screening later after this Q&A session, also no problem. So for all the attendees who actually come in for the free eye screening, we're also entitled for a, what you call, artificial tears pack, okay? Sponsored by the Sustain, Alcon Sustain. So there will be a hydration pack. We call it hydration pack because Dr. Lim just now did share about dry eyes problem as well. Dr. Lim, we'll go on to the question from Mickey, again from Facebook. Mickey seems to have a lot of questions for you. How effective eye comfort shield of our handphone protect our eyes? I believe that what he's asking is, you know, from our handphone, there will be some setting, right, on the comfort setting on the view. So how does it actually protect our eyes? Does it actually help? Or can I just maybe top up from Mickey? You know, there are some like glasses also say they have like those Blu-ray glasses and things like that. Does it actually helps to minimize or reduce the dry eyes symptoms?
Okay, this blue light thing, gadgets and glasses nowadays, many of them offer this blue light protection thing. It's, I would say, quite a fairly new thing, I mean, over the past few years. Now, whether this blue light is actually detrimental or is it harmful to our eyes, to our retina? Actually, it is still quite a fairly new thing. So research is still always ongoing. So far, the research has shown that there is quite a possibility that long-term exposure to excessive amounts of this blue light, it may be harmful, or it may cause earlier degeneration of our photoreceptors, of our retinal cells. But there is still, because it's still quite a recent thing, there is still a lack of what do you call a period observation, long-term studies, I would say. But early studies, early evidence just show that there is a possibility that overexposure to this blue light, although we're still not very sure what is the actual amount of exposure that's actually harmful. But there is early evidence that suggests that yes, it may be harmful in the long term. So that is why many gadgets nowadays, they do offer, or glasses, they do offer this blue light. A lot of it is probably maybe gimmick, but it could be some truth behind it.
Okay. We have one question from Yo and Ling. Today our Zoom attendees are very shy. They're not asked question directly with you, Dr. Lim. Maybe too much info to absorb and digest now for the okay, from Yo and Ling asking, what's the implication if the eye is cheery as opposed to dry eyes after long time working at computer?
Okay, that means, wait, let me see if I understand this correctly. That means
Okay. What is the implication if the eye is teary?
after a long time of looking at the computer.
Looking at the computer, right.
Okay,
Is
since
it opposed to dry eyes after?
if you are looking at the computer and then after a long time of looking at it, and you start to have tearing, I would say most likely it's dry eyes, because as I said, one of the main components of this computer vision syndrome is dryness. So usually if you use the eyes more concentrated on the computer for a long time, it will get drier. And in some people, when the eyes get too dry, they have reflex tearing. That means suddenly it's so dry, suddenly the eye decides to try and produce more tears. So there's time that you have watering. So in this scenario, yes, I would say that it's most probably dryness.
Okay, Dr. Lin, just now you share a lot about the contact lens wearer complications. So in this matter, if let's say any of this kind of complication happen and it becomes so severe, you did mention the only option was to do a cornea transplant, right?
Yes.
Yeah. So what would be your advice for those contact lens wearer? Like the number of hours that they should actually wear, should they wear like 7 days a week? I believe a lot of contact lens wearer like 12 hours a day, the moment where they wake up until the moment before they jump into the bed, they only remove their contact lens. What would be the max duration per hour? And like, is it good like 7 days a week, or should they give a break to their eyes?
Okay, well, generally, of course, the less hours you can wear, the better, of course. If you're saying that max, I would probably say if you really need to wear for a long time, try to like keep it like 8 hours or below.
8 hours or below.
Yeah, sometimes if no choice, maybe you can even like drag it up to 12. But I would say definitely nothing more than 12. It also depends a lot on the type of contact lens that you're wearing. Some of them, they have more oxygen permeable. They are made of more oxygen permeable material, such as like silicone hydrogel, which also tends to less likely to cause dryness. Okay, and some like those daily wear ones, they also tend to be more oxygen permeable. So it also depends on the quality, the type of contact lens you wear. But generally, I would say nothing more than 8 to 12 hours. Of course, like in a week, if there's 1 or 2 days, you can like go off the contact lens. That will be very good. I mean, yes.
At least I think it's as good as like if you put on a heavy makeup like every day, your skin need to breathe as well, right? So
yes,
I think it works the same for your eye.
Yes, give some time to breathe.
Dr. Lee, just now you did share about the glaucoma as well, which is the problem that a lot of people, how would they know that they will have any sign or symptoms if they have glaucoma? They wouldn't know, right? I remember during our recent live, you did share there's 2 types. One is the common one, which there's no sign of glaucoma.
Yes, correct.
So how would they, when was the best time for them to come in to check if they have glaucoma?
Okay, if they have a family history, if they have a family history, I think anytime they should come in as soon as they can, just to at least, even if there's nothing, we don't find anything, at least we have a baseline. We have a baseline of the findings. We have a baseline of their eye findings. For example, maybe when they come in at an early age, we can actually record the pressure the eye pressure at that moment. And we can maybe take pictures of the optic nerve appearance. Okay, so all this will act as a baseline so that maybe like a few years later down the road, when they come, we can actually make comparisons. You see, for example, we may find that when they came 5 years ago, their pressure was like pretty low. Now the pressure seems to be higher, And then we may also compare the pictures, the optic nerve appearance. Maybe you can see that the optic nerve seems to have undergone some changes if compared to the previous, their baseline examination. So I would say if there are definite risk factors, I think they should come in anytime. If they have no definite risk factors, then even then I would advise because one of the risk factors is actually age-related glaucoma. So I would say like anytime, like maybe 35 onwards, I think maybe you should just come in for a regular checkup.
Okay. All right. Before we take on one more last question from our Facebook, I was just wondering, any questions from our Zoom attendees you would like to ask? If not, I would like to share our next month topic by Dr. Umi. All right. So Dr. Umi will be the next month speaker. It will be in Bahasa version. All right. So it's kenal pasti masalah kesihatan melalui mata. All right. So if you would like to join our next session by Dr. Umi, that will be in our Bahasa version. So to follow us from our Facebook, as well our YouTube and our IG platform to find out more on this topic. And then we will send you the link for registration. So for those attendee who wants to join us in our Zoom session, you can actually do a registration by next month. We will send in the registration link. Okay, thank you, team, for sharing the poster for Dr. Umi. All right, Dr. Lim, there's one more question from Mickey. Okay, Mickey Kang asking Dr. Lim, can cataract grow back after remove?
Okay, cataract can never grow back after you remove it. So I'm sure some of us would have heard that, oh, cataract can grow back. Cataract has grown back. My mom had it done, and then now he has come back. But actually, cataract can never grow back. The cataract is like, it's like your finger. After you cut it off, you don't expect it to grow back. Okay, but sometimes people think, or maybe even some doctors may explain it in such a way that the cataract has come back, but it's actually not the cataract has come back. What happens is that sometimes, after a period of time, it may be a few months, it may be a few years down the road after cataract surgery, after a period of time, there's a possibility that a membrane may start to grow behind the lens that was implanted. Okay, so that is actually called a posterior capsule opacification. So if that membrane has become thick, it can again obstruct your vision. So a patient who has done a cataract, initially they will have very good vision, they're very happy, oh, I can see so well after my surgery. After that, maybe 1, 2, or 3 years down the road, then they say, oh, recently my eye has become blurred again. Is it the cataract is coming back? Well, actually, no. There's a possibility there is this problem. Behind the lens, there is actually development of this membrane already. So that's a possibility.
All right. Thank you. So then if the eye lens, that means the natural lens has been damaged, I believe the artificial lens can be replaced to prevent the blindness, right, Dr. Lim?
Yes.
If let's say if there's an accident,
yes,
so the natural lens has been damaged,
yes,
so an artificial lens can actually be replaced. It's
yes,
similar like a cataract. Actually, I think if you have a trauma, it will automatically cause cataract, right?
yes, many times trauma will cause cataract.
So it can also replaced by an artificial lens whereby it can prevent from blindness as well.
Yes.
So thank you very much. I think we have overrun the session like extremely because there's loaded of information Dr. Lim was so eager to share with all of you all. So thank you very much, Dr. Lim. Thank you for everyone's patience for joining us and stay with us for so long, and all the interesting questions for Dr. Lim. So if you do have more questions and times is catching up, do still continue to post in the chat in our Facebook, and then we will try to answer your question as well. So thank you, everyone. Good night. Thank you, Dr. Lim. Thank you. Good night.
Good night. Good night.
Thank you.